The information in the provider portal will help us greatly as we care for the population of foster children. We know in general that foster children have a higher complexity of medical needs. They often have chronic medical issues, emotional and behavioral issues, higher mental health needs. To complicate this even further, when these children come to clinic, we often, it's not uncommon for us to have a guardian or a parent that knows very little about their past medical care. And so what we value about the provider portal and what it allows us to do is have a window into their either current medical history or even past medical history. At the very minimum, the provider portal allows us to see where these children who have accessed care in the past, whether it's past emergency rooms or past clinics or hospital, even hospitalizations. But it also allows us usually a further window into immunization records, hospitalizations that's linked with specific diagnoses, prescriptions, as well as even information regarding when the last time this prescription was refilled. And so by using this information, we can have a much better understanding of the care that this child currently needs and what they'll need in the future. The provider portal does help us if we see children from other counties because we can access the information from their counties as well, not just from our own specific county. If a child does change counties somewhere during placement, the provider portal is incredibly useful because yes, that information that has been uploaded to the system, which would include all of the information that we have gained during our foster care medical evaluation, that information is accessible from that county as well. So it is a great way for us to share information between medical providers and between different counties. The way that we upload documents into the provider portal is that we fill out the forms that the Department of Social Services has given to us, and then they upload them to the portal for us. We sometimes do have children entering foster care who are not on Medicaid prior to being enrolled in foster care. And in that situation, their medical information would not be on the provider portal. However, as soon as they're enrolled in foster care, the provider portal kickstarts and begins to collect that information for us. The provider portal will allow us the ability to even pre-plan for these visits. So before a child comes in, I know what I'm looking at. Another wonderful thing that the provider portal will allow us to do is to track where this child has been and where they will be going in the future. Currently, if I want to track how many ED visits, emergency room visits a foster child has, I have to go and do a simple chart review, which is kind of a by hand task, and it can be tedious. The provider portal allows us to do this in an electronic way and gather this information much more quickly than we have in the past. The other part to that is that the American Academy of Pediatrics has recommendations for how often these children should be seen. And currently, if I want to track that in our clinic, I do have to do it manually with a chart review. And so also the provider portal will allow us to be able to track how often these children are getting care and if we are meeting the standards that the AAP has recommended. Another reason that I'm excited about the provider portal is that, as I've talked about before, it really helps us close the loop. So if we refer a child in foster care to a specialist or to their own pediatrician, I don't have to go back and track through records or make phone calls to see if that child has made these appointments. I can use the provider portal to simply see if the child has shown up and been treated for the reasons that we have referred them out.
For a child in foster care, when you look in Provider Portal, you're going to be able to see ER visits, you're going to get to see their regular doctor's visits. It'll show you if they've been to any urgent cares. It'll show you any kind of medication that they might be taking and what they're prescribed exactly, when it was last picked up, who prescribed it. You can actually even hover over some of that information and find out what that person's name is, their phone number and information, so that if you need to contact them about their last prescriptions, you're going to be able to see who their care managers are and those kinds of things, and get them reconnected with physicians if that's who they've been seeing regularly, or if they haven't had any regular schedule, to help them get more organized with their schedule with their new providers. We manage foster patients when they come in by pulling up the portal for each child and making sure that if they've had any ER visits recently, if they've had needing any follow-up, last time they've been to the doctor, what they were there for the doctor for, what kinds of diagnoses they have, if they have acute illnesses that need regular management, if they haven't been to the doctor for a long time. We use it to make sure that we know what kind of medications they're on, so we know if they need to go sooner than later for their med management. We use it in talking to parents just to make sure that they can kind of give us what their medical concerns are. A lot of times parents are stressed when they first come in to care, and they're really not sure of the history, or they don't give a very accurate history for lots of different reasons, or they may not understand what the history is to give it accurately. And so it helps our providers kind of understand a little bit better what's going on with them. It also helps for child welfare to know if they need to take children to a provider more quickly rather than waiting for our first appointments.